My name is Dr. Khadijah Lang, and I am a family medicine with full competency private physician. How long do I have to go over the list of reasons that I hear from patients and parents regarding vaccine hesitancy and declining vaccines? One of the most common that I hear is that a concern that they're being experimented upon, that this is something new that came out of the sky. Nobody really knows what this is. They don't know how did they create this so quickly. A lot of distrust in the system. And of course, one of the big reasons that people will give is the clear-cut fact of not only the Tuskegee experiment, but also the situation with women being sterilized without their consent or permission or knowledge in jails, in hospital settings, in mental health facilities. But there's also this would not be the first time that we've been experimented upon if in fact this really is not something that's already been appropriately tried and proven. COVID-19 is still here, so people wonder why should they get vaccinated? What would they gain by doing this? And I think it's important for people to, number one, know that people are still dying from COVID. People are still getting COVID, and people are still dying from COVID. As the numbers for COVID decrease, the numbers of deaths for flu will start peaking back up. I feel confident that as we put away the mask and come into the flu and winter season, these types of respiratory illnesses, which are spread through the air, are going to increase again. And when they increase, unfortunately, the death rate from these diseases is always higher percentage-wise in the African American community. So I think that it's important for us to be aware of the fact that we are coming into a season where these types of diseases pick back up and they are spread throughout the air. And so protecting oneself becomes an important thing that we should be considering doing. Some people's immune system is such that they are literally medically unable to safely take a vaccine. So if you come across somebody like that who has no choice and cannot receive any type of immunization, by immunizing yourself, you are decreasing that person's risk of catching something from you who doesn't have the capacity within their healthcare, their body and their immune system to properly fight something off. Our country had the worst rates of COVID deaths of any country in the world. And we're a developed country, but we didn't have a good understanding of public health measures. The public health system was doing their part, but people weren't hearing the messages or accepting and believing the messages so that they could incorporate that into their behavior, and therefore we could all help protect each other. And I think in some ways, I think some people felt like, well, if other people are vaccinated, why should I worry about me getting vaccinated? I don't need to do anything because all those other people took that dangerous, questionable thing. And so even if there is a real disease out there, if that thing works, then I'm protected because all these other people have already been immunized. And if it didn't work, then it wouldn't make a difference anyway. So I think understanding and listening to the messages put out by public health is a very important thing for all of us to consider and respect as we look at potential for future pandemics.